Friends, I'm back with another video about kidney stones. I have one kidney stone video about my first experience with them that's very popular on YouTube now. And this is a follow-up after my second episode with kidney stones. And this one goes much more in depth with treatment because the first kidney stone I had, I was able to pass. It was a 3mm stone. I was dealing with the fear of it and talking about the experience, the pain, what to expect when you have a kidney stone. This time it was kind of a much more serious situation because I had a 10mm stone that had stuck in the little area where the ureter, however you say it, comes out of my kidney. In other words, the P tube going down into my bladder, the stone had stuck right at the entrance of that as it left my kidney. This is my left kidney now. As it stands right now, I still have a 7mm stone inside my kidney and two 4mm stones that I'm just waiting for them to pass. But the story was this 10mm one that stuck there and was blocking the draining of my left kidney into my bladder. So this video is going to talk about lithotripsy, and I think it's pronounced ureteroscopy. Forgive me if I'm not pronouncing it right. I've heard it said different ways. So I had to have both of those procedures done. So let me tell you a little bit about the experience of those. So first of all, I was told, okay, well, this is a big stone. You're probably not going to pass it. 10mm is about the size of a big pea, right? Or I guess it's a good example of, I'd say about the size of a big green pea. And so I was given the typical drugs. I was actually given a pretty strong opioid this time, stronger than the last time. Last time I was on oxycodone. This time they give me something called hydromorphone, which is a pill form of morphine. And so I was told to stay on that stuff, man. I was still given Flomax or, I'm trying to think, maybe I wasn't given Flomax for this because I don't think they wanted it to go further down in my ureter. I was definitely taking some, because I was on the hydromorphone, which will make you sick, or at least it made me sick. I had to have, this is terrible, but I had to have some suppositories that I would have to put in to keep me from getting sick. I would take those about 5 minutes before I took the hydromorphone. Or I was also given something called ondansetron, which I cannot remember the commercial name for it, but that drug also, it was an anti-puke drug that would keep you from throwing up while you're taking the very strong opioid medicine, hydromorphone. I think people call it Dilaudid. Dilaudid is what it was. So anyway, that kept me largely out of pain. I didn't even feel like eating during this time. I had to wait, honestly, like 6 days before an opening came in an hour. It was like a truck comes to here locally, a lithotripsy truck, and it only comes on Thursdays. Well, I have my attack on a Friday, so I had to wait 6 days. Now, in hindsight, I wish I'd found some other place that was covered with my insurance and gone sooner. But I will tell you this. This is the deal with lithotripsy. If you are a heavy person, I want you to know that lithotripsy may be a big old waste of time. Let me tell this story real briefly, then we'll move on into the ureteroscopy portion of this story. Don't want to waste your time, but here we go. So the experience of lithotripsy is you basically go in, just like any other sort of surgical procedure, even though they're not going to cut on you. You don't eat the night after midnight, the night before. You don't drink. You go in. I had an early appointment, like 7:30 in the morning, and they give you pills and stuff, and start at IV. They get you relaxed, and then they take you back. And like I say, the lithotripsy truck. It was a truck that comes once every week to Valdez Hospital or Caroline's Healthcare System, Blue Ridge Valdez. I want to say this big shout out to all the people who took care of me from the time I had my attack to the time I went through lithotripsy to the time I had the ureteroscopy. Those people were fantastic. Couldn't have asked for better care. Awesome. Dr. Brian Bauer was my urologist. So let me tell you what happens. They take you back to the truck. They lay you down on a table. They position you so that there's like a sack of water or sack of liquid of some sort, and sound waves are channeled through that water and triangulated in such a way that they hopefully go up and they converge on the stone. They give you what they call about 3,000 shocks, which are actually sort of loud, snappy clicks that shoot waves into the stone. Now, I can remember this treatment starting, And then I can just remember kind of snoozing through the whole thing. It's almost like I was in a faraway dream. So I don't know what they gave me. It's like I was semi-conscious, but really unaware of everything. It's almost like I took a nice nap and I woke up at the end. It didn't seem like it took 5 minutes, but I've been in there for 30 minutes or so while they shot thousands of sound waves. They're supposed to break up the stone. And the doctor told me, he said, well, hopefully we'll turn it into pixie dust with all these shocks. Well, it did not turn it into pixie dust. I came out and the stone was still about 8 millimeters. It was still huge. It was able to somewhat advance down into my ureter, and it got halfway down the tube and stopped. Okay, so here's something to consider. If you are a heavy person, he told me after the fact, now that's where I feel like this maybe was a big waste of my time and money, that if you have 10 centimeters or so, that's probably going to be about, what, 2.5 to 3 inches, something like that, of flesh between where the stone is and where this water sac is. If there's that much, then it's probably not going to be very successful. So they tried it, and it was not very successful. It smashed a little bit of the stone, but so let me say this. So what to expect, even though I went through that, it did smash some of it. And I guess I came home that day expecting there's going to be little fragments of stone pea. You're scared of it. You're frightened. Well, you're straining the pea. They give you a little thing naturally that you strain your pea with to see what kind of little stone fragments come out so they can test those stones. Nothing came out. Nothing the next day. Nothing the next day. I think maybe on the third day or so, I got some tiny little beady fragments that I thought were stone. Don't expect all these fragments of stone to come out. You think you're going to pass thousands of little tiny fragments, and I don't know. Again, it was marginally successful for me. They broke tiny bits of it off, and I did see a few tiny little portions, but it was nothing to worry about. You stay on the Flomax, you're able to pee this stuff out. Well, I was within a week, it just wasn't passing. It became clear that they had me go back and took another x-ray. They could see the stone was still in there. It was just a small bit less than it was before. And they said, okay, we got to do the ureteroscopy. So what that involves, folks, is they put you to sleep. This is almost like a surgical procedure, I guess. You actually go under, and they go up into you, and there's only one way to go up in there, right? So you know what that means. Yes, it goes up through there, and then they go up into your ureter, into the tube that connects your bladder with your kidney. They go to where the stone is, and they use a laser of some sort to bust up the stone. Now, that was successful. It took that to get the stone smashed up. Now, I still haven't seen big portions of this stone or anything. I've passed one like 3 millimeter piece. It was about yay big, something like that. And so that was, you just go, you lay on the table, or they put you onto the surgical table, knock you out, you come out, and it's hopefully the stone's gone. Now, the worst part of that, let me give you the follow-up. This is kind of what was the horror of the ureteroscopy, was not the procedure, not really the aftermath of peeing out, but they put a stent. When they do the ureteroscopy, they say that it can inflame, the fact that it's been up inside your ureter, they've been shooting lasers and mess up in there. It can cause inflammation inside your ureter, the tube that goes from the kidney down to the bladder. So they'll put a stent in there, a little tube that will hold it open. And so there was a little tube. Now, I didn't know how big it was. I wake up and they tell me, oh, we've put a stent in. This was the bad thing for me, is they didn't tell me what that meant. The doctor was too busy. He was out doing more procedures. So I go to the bathroom the first time to pee, which, by the way, hurts after ureteroscopy. You're going to burn for about a day and a half, 2 days. It burns pretty bad when you go pee. It's not totally unmanageable. You're going to be on pain drugs anyway. You will bleed some. Your pee's going to have blood in it. So don't be shocked when that happens. And it is going to burn and hurt when you go pee, but you'll make it through it, I promise. But the stent, they didn't tell me where the stent was. I'm thinking, crap, is the stent from my bladder to the outside? So you go to pee, you're almost afraid to look down. It would be good if a doctor, and I'm sure other doctors explain this, what to expect when we put a stent in. So what that means is, well, what it really meant for me is they put that tube going from my kidney down into my bladder to make sure that the ureter or ureter, whatever you call it, that it stays open and you're able to drain urine down into your bladder. Now, people have told me that have had this stent put in that sometimes they tie a string or connect a string to the end of the stent, and the string comes out your, I did not have that. I go to pee, I don't see anything. I'm wondering, well, where the crap is the stent? Well, the stent, later I find out from a surgical tech that the stent is going between my kidney and my bladder. Okay, so now my next question is, well, how do they get this stent out? Because I was told that the stent would stay in for 10 days. And so how does it get out? Well, guess what? The only way it gets out is the way the ureteroscopy went in. Only they're going to go in and get the stent. They're going to go in through your penis. They're going to go into your bladder. They're going to grab the stent and pull it out while you're awake and fully aware. Okay. So this was to me the horror of this. And listen, it wasn't as bad as I was thinking it was going to be, but it was pretty bad. I'm just going to be honest with you. My experience with it, here's what happened. My doctor, I will say this, he didn't tell me to drug up before this, but I had some medical friends, some other medical friends that gave me good advice. They said, whatever your pain medicine is, take one, consider taking two. And I did take one. I took one of those dilaudid, one of those hydromorphones before I went, about 30 minutes before. And so I was, my pain the edge was knocked off. I wish now, hindsight, that when I went to get the stent taken out, that I had taken probably two of those things. And I'm not going to. I don't want anybody overdosing on drugs or anything. So, but I did find out after the fact that a guy my size, I could have probably taken 2 or 3 of them, and it would not have bothered me or hurt me at all. It would just have made the pain even less. So, I swear, he took a medical tool that looked like it's hard to describe it. It's like a stiff cable in a way, and honestly, it was about as big as a pencil. I'm talking about diameter. It was a round cable with a little device that could come out of it and grab things. So it was. I'll try to find some illustrations that's online and put it over the top of what I'm talking about so you can visualize it. But he's going to put this thing, it's about the size of a pencil, up inside you. So let me describe what happens here. So because this is going to be the most vivid thing you're going to remember if you have to have this ureteroscopy, and if you have the stent in, and you probably will. So what happens with that? Well, they bring you in, they put you on a table. He had an assistant with him, and you got to take your pants down and everything. You got to lay there. They're going to give you some stuff to make you a little bit comfortable. By that I mean they shoot some stuff inside your male organ there to hopefully numb it, and it somewhat numbs it, I guess. They also run a catheter into you, and they fill your bladder up with liquid so he can see in there better. At least that's what they did with me. So they put liquid into you. First they numb you, then they put the liquid into you. Then the doc comes in. He did a good job of trying to, I don't know, he just casually talked with me while he's doing it. I guess trying to keep my mind off of it. And that helps a little bit, but you stay, basically I'm just staring at the ceiling tiles and just, oh Lord, I hope it's over fast. And it was over pretty fast. He put the big tool, long tube type thing, down into me with the little grabber on the end of it, grabbed it and pulled it out. I guess the whole ordeal took about a minute to a minute and a half. I'm guessing it felt like it's longer than that, but probably 60 to 90 seconds. He pulls it out. It was a very thin little catheter type thing, the stent was. I don't think it was maybe more than 2 millimeters. It looked very small. It was about this, maybe this long. So it was pretty long, over a foot, I guess. Maybe 14, 15 inches. Pulled it out, okay. Then he sent me to the desk. I pulled my pants back up, get everything on, sent me back to the desk to go pay and fill out papers. But here's the deal. You're so full of this liquid they have pumped you full of, you're just like busting to pee. So my wife had taken me. You have to have somebody go with you because you're going to be on some drugs, hopefully, and you need somebody to drive you back after they had this stent removed. I was standing there at the window for like 45 seconds. I told my wife, you handle this, all this paperwork, I'm going to go pee. I got run to a bathroom, and it took a long time for all the pee to come out. And again, it was painful. But I will say this, after recovering from the stent removal. It wasn't as painful as recovering from the ureteroscopy. Like I say, about 2 days of pee pain with that, maybe a day of pee pain with the stent removal. So I'll say this: if you're a larger person like me, and I'm over 300 pounds, 6'2", so I'm a big chunky guy, you're probably going to be wasting your time going for a lithotripsy. And I'm not saying don't try it. Talk to your doctor about it. Ask him, should I have lithotripsy? Is this going to be successful at all? Or should I go straight to ureteroscopy? I wish I had done that going forward in the future. When this 7mm stone that's in me starts to go into my ureter again, it starts to get stuck, I'm going to go straight there. I'm going to say, look, ureteroscopy, that's what's got to happen to get this stone out. So that is my long story. I don't know if there's anything else. If you have additional questions, go ahead and ask them. I feel like after this second time, I can talk a lot more intelligently about it. The first video I say describes just the intense pain that you're in. I had basically the same sort of ordeal with the pain as the last time. The one thing I will say this: if you're a kidney stone veteran, like the first time I went, it was like 4 hours of excruciating waiting while I go through tests, ultrasounds, CTs. Just back there waiting, for pain meds, because the only thing that's going to stop the pain is some kind of opioid like morphine pumped into you. This time I go to Valdez Hospital, Carolinas Healthcare System, Valdez it's called now, and Carolinas Healthcare System, Blue Ridge Valdez. Forgive me, I work for the people, so I got to say their name right. I actually had some of the meds with me. I took them with me to prove to them that I had prescriptions for these things. But see, here's the deal. So you think, okay, I've got this pain. I should be able to take my meds and get out of this pain. But no, it doesn't work that way. You are so sick when you have a big bad kidney stone attack that you can't hold anything down. Even if I could have taken my oxycodone, I would have puked it right up. I'm telling you, there's no way you're going to get ahead of that pain until you get the morphine in you. So I go into the emergency room. They could tell I was just in excruciating pain. I said, listen, I'm not a drug head or anything. I'm not an addict. It also helped that I worked for the organization. So I'm sure the people knew who I was, but I think more than anything, it's that I was prepared. I said, I'm having a kidney stone attack. I know that's what it is. I've been through it before. Here are the meds that I've taken before, and I'm here to tell you, all I can do, I need morphine now. And they know that. People in the emergency department, if they are experienced, they know, they can tell when somebody legit comes in that's having a kidney stone attack. So the point with this time is I waited 4 hours when I went to the other hospital. This time, I think within about 30, 35 minutes, maybe 40 minutes or so, I was having morphine shot into me. They pulled me back. Yeah, he's having a kidney stone attack. Let's go. They have to go shoot the... They give you some sort of low-level drug that really doesn't help very much. At least they gave me some. Was not real successful in alleviating the pain. I was in a lot of pain. They took me back to a CT area, did a quick CT scan. They could see exactly where the stone was. They shipped me back in. Doctor gets me the morphine. I'm on morphine, and then I'm getting my legs back under me again. Then I can get on the hydromorphone or the oxycodone, and I can make it through the ordeal till I can get the stone blasted out or lithotripsied out, whatever. So I'm just giving you, this is a tip. If you've got kidney stones, if you've had them once, you may have them again. You're probably going to have them again. Most people do have a second round or a third round or whatever. Right now, I'm going to do a separate video on what I'm trying to do to keep from getting them in the future. I know what I did to get the ones that I have now, and it was eating a lot of oxalate foods without calcium. Most of the stones are calcium oxalate. A whole nother video I need to do on that. But why you don't really, you think you want to avoid calcium foods and avoid oxalate rich foods. You don't really want to do that. So we'll have a strategy talk about how to eat, because believe me, I've done, once you have had them, if you're the kind of person that does research, and I work in the medical field anyway, I'm a marketer guy, not a medical guy. My wife is a medical person. She's a respiratory therapist. But once you have them, and if you're a research type person, you go out and you find out everything you can to not get this, because it's the worst. I'm not kidding. It is the worst. So you know that if you're watching this, you've been through a kidney stone, or you're getting ready to go through some of these procedures I'm talking about. None of them are horrible. Like I say, the worst part of everything I went through was the removal of the stent, because I was fully awake and aware. Next time, you live and you learn. I will drug up really well before I go to get the stent taken out, because I'm sure I'll probably have to have this at least for the 4mm stone. I will say this, or excuse me, 7mm stone. I've got these 2 4s in me. I have passed just recently a 3mm stone, which I think was the fragment, one of the fragments left over after the ureteroscopy. So yeah, it was about yay big, about that big, about the size of a, what would you say, a grain of rice or something. It was comparable to that, and it wasn't bad at all. You just stay on the Flomax, you just stay hydrated, and you'll pass stuff like that. My first kidney stone was that size, and it drove me crazy. Second time I passed a 3mm stone, it was no big deal. So maybe you get tougher, maybe you get used to it. I think for one thing, the fear, the alleviation of fear, you've been through it once. It's not quite as bad the second time. It's still super painful, but at least you know what you're dealing with, and you're not having to deal with the anxiety as well. I'm going to end here. Another future video on I think I want to produce about avoiding the things you do to avoid kidney stones. So that's coming up here in maybe the next couple weeks. Peace to all who watch. Subscribe to the channel if you like.